Well, good afternoon, everybody. You had all these English speaking with beautiful accents, all of them, and now you have me. I'm really sorry. But then I have this Spanish charming accent that you all associate with your holidays. So I can say in English more than dos cervezas, por favor, so I'm okay. Right, so it's so delightful to be here. It's so great to be able to come back to these sort of events and to be up here talking to you is just I'm absolutely delightful. Right, and I'm going to talk about comics. Comics, doctors, what is this all about? So I hope I get to surprise you a bit, and I hope I get you to get excited about it. That's biomedicine, isn't it? That's the medicine we are mostly taught and trained to do. But that's not the medicine we like, that's not the medicine we should be doing, but this is the power of a cartoon. So to fight that kind of medicine, we have events like this. So I have to start by saying thank you to the three lovely hosts and say this is an incredible event where we all sort of regain our sense of what being a doctor means. And I want to thank you, Ian Williams, who should be sitting here somewhere. Ian, where are you? Hey! Ian, who coined the term graphic medicine, is the one who opened my eyes to the power of comics. So I can never be grateful enough to Ian's work and his own discovery. Now, I want to do a tiny experiment. I want you to all close your eyes, and as you have your eyes closed, think of a comic character. Open your eyes. How many of the characters you thought are not there? 1, 2, 3. Yeah, so few. And congratulations to you all. You are the cleverest in the room. Right. Now, the comics I'm going to talk about are not these sort of comics, which are the ones that everybody thinks they are just the comics. The comics I'm going to talk about have real people in them, real characters that talk about breast cancer, that talk about ALS in its terminal stages, or pancreatitis, pancreatic cancer in this case, and terminal care, Parkinson's disease, grief after the suicide of a son, depression, herpes, terminal COPD, terminal cancer, brain tumor, lung tumor, life in a nursing home, a little girl with Down syndrome and a problem in her heart, a child born with a severe illness. This is what we call graphic pathographies, and these are comics that are the biography written in first person, as biographies do, or in third person. So it's somebody who has always been doing comics, and suddenly when they are faced with illness, they decide to tell the story through a comic. And they make truly amazing reading, and they are really, as well, very, very useful. So for the time being, let's just agree on this, that comics are not just for children, although they are magnificent reading for children as well, why not? But they are not just for children. So what makes comics special? Comics have got such an unusual sort of language. They are such an incredible way of communication. They're so special, but only if you stop and think about how comics work, then you realize the beauty of them. For example, comics are often called the art of the invisible, because what happens in between these two vignettes becomes a story in your head, although most of the story is not there. It's like a film where you remove most of the photograms, and then you end up with two, and your brain builds a story that is not really there. What it does as well is that it brings invisible things into visibility. This is by Agustina Guerrero, a really fantastic comic artist in Spain. But this is really useful for medicine. For example, we were talking about how you cannot test for voices in the head. But this is the way an author who suffers with voices in the head will draw it. So people will be drawing depression. This author as well, she's Spanish too, she will be drawing her depression with this amazing language, with this sort of metaphoric language, which is so powerful because it's visual. It's so incredibly powerful, and it brings emotion, and emotion always makes any language stronger. Metaphors can explain how somebody who witnesses an epileptic fit would look like. So this is the author, who is David B., describes the way his older brother, suffers these epileptic fits. And he turns them into this monster, this lizard snake, just turning his poor little brother around many, many times and just making us feel really anxious about it. So it really transfers lots of emotion in there. Comics can take you anywhere. They can take you anywhere in space and time. They can make you tiny and make you just go inside the mouth because there is going to be a cancer somewhere there. So you can just squeeze and become a tiny little creature that goes into absolutely anywhere, backwards and forwards. Same thing with time. You can become a doctor examining this brain that suddenly has become a huge place where you can just walk around and discuss with your colleagues what's going on. In this particular case, parenthesis is a French author who describes her brain tumor in a very graphic way. Another thing that comic language does, which is amazing and so helpful, is that it allows us to see what the character says and what the character thinks simultaneously. So when you get that, what other medium would you get where you can see what people say and think at the same time? So it's quite an amazing way of telling a story where you move things around in a way that no other medium does. Yeah, but okay, so I've given you a few things that maybe you feel are curious, and well, they seem okay, but how could comics be useful for doctors? In what way can comics be useful for doctors? There are many ways, but I've chosen the two that to me are the most important ones to sort of try to convince you today that they are. The first one would be that the comics provide us healthcare professionals, particularly doctors, with a mirror to see ourselves through the eyes of the patients. These patients have not done their graphic novels for us to read. They just do their novels because that's what they do. So they have such a refreshing way of drawing their experience with illness that has nothing to do with the way we study illness or the way we read about them, or even the way the patients tell us about their illnesses. They will not tell us about ourselves. So this is such a fresh way to see how patients see us. Look at this. I mean, you could do a communication seminar with medical students just with this. This is the way Elodie Durand describes how doctors made her feel when they were studying her situation. She started with having sort of epileptic little fits, and she was under a study for a long time. So imagine, just this could start, because this is what they do, they start conversations. They're really, really powerful in themselves. So this is just 2 vignettes from one single page of a whole comic, but this is already so useful. They are telling us that we are not very good at communication. This one, Que no me muero, is a Spanish author, is a brilliant comic about breast cancer. And this image, the author, who is the patient, explains how she's just come out of theater after a lumpectomy for breast cancer, and this surgeon, sorry, as surgeons do, will come in the room and start giving all sorts of explanations, starting by, oh, you know, your operation was beautiful. You know how we say to patients, oh, your case is beautiful? And that's a bit shocking for poor patients. But anyway, so he tells her, oh, your operation was beautiful, and then he starts telling her about the unusual anatomy that she has, but in detail. Well, look at the face of the patient, and they're like saying, what is he on about? She was really sickly. She just come out of theater. And so, again, this is just such a powerful image for us to see what we are making patients feel like. This is great. This is from a chance. It's only just been translated into English not long ago. These parents, who are the authors of the comic, had just had a baby. Throughout pregnancy was fine, no signs that the baby was ill. And the moment the baby is born, the baby is very ill. So they take the baby away, and then these white coats start coming in and out of the room, giving information in cryptical way. So this is the way they describe. I mean, these 2 parents who had just given birth to this baby, see all these white coats coming in and out. In this one, which is about autism, Habla Maria, this is from Chile, the author. Look at this. I mean, this doctor who has lots of science, lots of titles, lots of knowledge, but at the end, when they are leaving the consultation with the little girl who is down here, the dad looks at the mom and says, "Did you notice? He's not even smiled once." Or same with looking at patients' faces. This again is from a chance, and baby's been born for about 24 hours, very ill, doctors come in and out, giving all sorts of explanations, and then this pediatrician comes in. And this is how they draw it. And what they say here, the parents, is, "What a strange fellow. He's never even looked at us." This is hard, isn't it, as doctors, to see how we get portrayed. But then this is so useful, because we can learn to do it better. We are getting a message from them. In California Rocket Fuel, the guy on the left with the funny little yellow nose is the patient, the guy on the right is the doctor. He's depressed, the patient, he's really upset. "I hate myself, and I hate other people too, and I don't find pleasure in anything, and I'm really sad, and I feel empty," and he starts crying. "And, you know, I have this anxiety," and he's just crying and all over the place, and the doctor doesn't move an inch. Have you noticed? The doctor is like, taking notes, as we do. Well, here at least there isn't a computer in the middle of everything. In Cancer Vixen, which is an amazing comic about cancer, American author, they go into the doctors, and the doctor gives them a long explanation about the illness, but this is all the patient and her mother understand. They just pick up on little words. They understand cancer, lumpectomy, may not be invasive, lymph node. They've missed the rest. The vocabulary he's using is not very good. And they say the last doctor's visit without a tape recorder. They plan to bring a tape recorder, and from now on, then later, listen very carefully to what was being said. This one is amazing. I mean, this one is in Spanish, but this elderly woman, who is the mother of the author of this comic, she's plain. She doesn't go around it. She goes, "Doctors, they feel they're God." So strong, isn't it? Strong stuff. And the second side to comics, the second use that we can give to these graphic pathographics, to graphic medicine in general, is graphic novels, comics give visibility to the part of illness that is not visible. And obviously they are incredible with mental health problems, but also with all that part of illness that we cannot measure. We cannot do ECGs for it. We cannot get a CT scan. We cannot MRI, blood test. It cannot be tested. It cannot be shown. It doesn't show anywhere. But it is what most of the times makes the patient suffer most. And there is a long list of things about illness. Probably one of the most important ones is fear. She's saying this is the wife, very young wife of a man who has got advanced larynx cancer. And this is a series of 6 different vignettes. I put 4 here, and she's just completely destroyed. And she manages to just say, "I am afraid, I'm frightened," because fear is one of the strongest feelings of somebody who's been diagnosed with a serious condition, with a serious illness. The presence of the worrying future, the presence, that's untold or unmentioned presence of death when a serious illness is diagnosed. And sometimes in some cultures, like in the Spanish, we are very strong on that. We don't want the patient to know. We are still playing on this, let's not tell them everything because they will suffer. But suddenly there is this present. Before I saw the X-ray, there were 3 of us in that room. Now there were 4. Again, is fear in this situation, is fear of death as such. The patients normally are not going to be vocal about that. They just come in and get all our explanations and what the treatment is going to be, this and that. But the fear of death is there, and they are telling us in a very refreshing way, these graphic novels. This is great. This is vulnerability, which is one of the main things when you become a patient. This graphic novel, Sostress, is about a young woman, who is the author, who has a motorbike accident, very serious one. And then she's just blue lighted to A&E. She's taken into the research room. She has all her clothes removed. Probably, I don't even need to see to know that the door is opening and closing behind her all over the place. And then people start talking to each other above her in words that she doesn't understand. Imagine her sense of fear and mostly vulnerability. Like she doesn't understand the things, she's in pain. And she knows things are going to happen. She doesn't know whether she's going to survive or not. And just look at her expression. And this image that uses symmetry, it's just so strong, so powerful as well. The moment you give patients a bad diagnosis that we do all the time, particularly in certain specialties, and the worst thing that can happen is that you get used to giving bad news or giving the news of a terrible diagnosis. So many authors include their feeling on receiving this first diagnosis of this awful illness. So the author of Cancer Vixen describes being told that she's now has a breast cancer when she's about to get married in only a few days' time, like being absorbed by this cocoon and falling into a black hole. And this is the way that she explains how she felt the moment she was given the news, which, by the way, was given on the telephone. In case of my degeneration, which is, again, the time that he's been given the diagnosis of Parkinson, and he describes it as a meteor striking your world. So again, this is another way, this is another strong metaphor of explaining what it's like for patients to receive these really terrible diagnoses that are going to change their lives, even if they are not going to kill them, but they are going to make them be, at least for some time, different people. Pain. Pain is something that we cannot measure. Pain, actually, we know now, is in the brain. Some illnesses, in this particular case is Crohn's disease, causes a pain to this author, who is Pozla, is a French author. Surprisingly, he's not been translated into English, it's translated to Spanish. And the title is something about guts and heart. So he often describes what the pain of his illness is like when he gets complicated. It's a really bad Crohn's disease who gets complicated, gets lots of operations. And he describes this, what Cecily Saunders from palliative care used to describe as all body pain. It's just you become pain, you are pain. So this poor guy is all about his guts being hurtful and him being completely brought down into nothingness, because he can hardly be himself with so much pain. So all these ways of describing are useful. This author does something very funny, well, not very funny, but very unusual. His book, he marks with that little stomach and bowels, those comics that he drew when he has been admitted to hospital. So you know when you are reading that some of them are just done with the purpose of the book, but others were actually drawn. And this one was drawn when he was actually admitted to hospital. Another about pain, this is as well by Paco Carrión, which is another author. This guy has had a back operation that went wrong with lots of complications. And this amazing drawings is the way he describes the pains, the horrible, unbearable pains that he gets in his limbs. Again, they're really strong sort of images for us to try and understand and try to be empathic with the way that they suffer. And sometimes they find it difficult to explain, because pain is such a difficult thing to explain, and it's such a, obviously, impossible thing to measure. And we tend to disregard pain often. We do that in hospital all the time, like patient calls, look, I'm in a lot of pain. You've just been given morphine, what are you talking about? So for us, pain is just their pain, which is always not that important. I mean, we are the doctors, we really know. If the hours have not gone by, then the pain is under control, even the patient says so, or doesn't say so. My Alcoholic Escape from Reality, this is a manga. Nothing special about mangas. Mangas are Japanese comics that get read from back to front, but they're exactly the same, they're just comics. And this is the way the author, who is the main character, explains the pain of pancreatitis she gets because he's an alcoholic. And she says, the pain was like a giant sea urchin rolling between my ribs and down into my abdomen. She draws about her pain very often in this powerful book. What about balancing life? What about, I mean, this is such an amazing metaphor of what it's like to be ill. In this mom's cancer, the use of metaphors is amazing throughout the whole graphic novel. But in this particular case, they are talking about balancing side effects with the proper effects of the medication that she's on for cancer. So it's like chemo kills good cells as well as bad cells. Mom needs to make more red blood cells, but not too many, so things are starting to get quite bad. Drugs to thicken, drugs to thin. A witch's brew of tongue-tangling trademarks is a spectacular trial and error balancing act. Of course, it's not only about images, it's about really good text that adds up, and just giving this combination of text and images that becomes so good, so powerful. If I would ask you of a term that you think these two might come to, I mean, these are things that happen in hospital that for us healthcare professionals are just normal things that happen that have nothing really interesting to them. Can anybody think of a term that I'm going to just mention? Well, this is about dignity, isn't it? It's about dignity. I mean, some very basic things like doing a wee and doing a poo as normally very private things, and then suddenly it becomes everybody's business what you are doing with your bowels and with your bladder. This is explained and is seen often in these graphic novels. In this case, the author says, it's incredible how something so small can be so humiliating. And despair, look at this image of marbles. This is about mental health. And in this particular case, the medication has stopped working. And look at this image. I don't really need to explain how the author is feeling about herself. She says, I could feel myself getting swept away. And then there is scars. For us, scars is a normal thing, but people can be really squeamish about scars. And of course, is that new self-image when you have had, for example, a breast removed. I mean, for women, that first time that they look at themselves in the mirror after having a mastectomy can be quite hard for many. And they just draw about them. Or that idea that the moment you lose your hair because you are undergoing chemotherapy, your illness becomes public. Until that moment, you're ill, nobody knows. But then suddenly you lose your hair. It's like going out in the streets with a big paper that says, hey, I've got cancer. And that's not easy for people to become like a walking advertisement of what's wrong with them. In this particular case, author, again a Spanish one, he has testicular cancer. And he says, he's been very ill for a long time, but he says, well, now I do have cancer, because now it's visible that I've got cancer to everybody else. Or becoming a victim, another Spanish author, becoming a victim, which he absolutely claims against being a victim of the medical world, of becoming the center of something. And again, many authors write against all this pink ribbon marketing and all this. Many people think strongly about it, and I found several comics that talk about that. Questions. Suddenly you have all these doubts when the doctor tells you, right, have you got any questions? You've just been diagnosed with diabetes. Any questions? He's got so many questions that his head just explodes. This one is amazing because this one is not only a comic, but is written as a form of poetry. So this is particularly amazing, this book. Loneliness. Loneliness is one of the features of illness as well. Initially everybody pays attention to you, but then you start dropping out of other people's activities because you are ill. And you might end up finding yourself like that, as this is, I'm just so alone. This one is about depression. The whole novel is drawn like this. They look like just scribbles. And loneliness can come in different ways. In this particular case, in Monster, where he's got herpes, his fear of loneliness comes from the fear of being contagious to somebody else. So he says, let's face it, nobody wants to fuck a monster and become a monster themselves. Become independent. Those of you who have dealt with the end of your parents becoming very old and very fragile. And anybody who becomes very ill becomes sometimes like a child. And this is so beautifully drawn by Marianne Farnell. Then what matters to us, doctors, is not normally what matters to patient. In this novel, when David lost his voice, this is the doctor and the patient who are, by the way, friends before he gets this diagnosis. He's telling him about the illness. He says, you've got supraglottic cancer of the larynx type. He gives the T3 N26M6. That means that you can make it. It's a stage 3 tumor that had spread to more than one lymph node with no metastasis. Then you can see David in many other images drifting away. It's like he's not there. So the doctor says, David? And he says, no, I'm here, George, I'm here. And then his question is not about his cancer. His question is, what about Tamara? She's only 9. So his worrying is his little family, his little daughter, who's only 9. What's going to happen to her now? It's not about the cancer. He says, oh, don't worry about Tamara. We're going to get you through this. And what about all those desires, all those plans that people have for the future of their lives that might not become true, might not come true, like this cancer vixen? She's about to get married, as I say. She was planning on these 3 children. She gets diagnosed, she goes into chemotherapy, she's told it's unlikely that she will have children. So you get these images of these babies that come to say goodbye to the mother, babies that are never going to happen. Hey, Mom, up here, your son wanted to say goodbye. My time is up. I'm not happening in this lifetime. Poof. I'm the only one you have time for now, and the clock's tick, tick, ticking. So, comics are not only mirrors to see how we deal with the way we practice medicine, but also I like to portray it as a window, as a big window that can let us move from the illness to the ill, from the problem to the person. And if we could get medical school to get students to learn about diabetes from a big Harrison book, and then to read a comic from a patient who suffered diabetes, and then the biomedicine and the patient's view. So this is sort of moving the focus from medicine to the patient, from biomedicine to the patient, of course without losing the science, but that's something that we all take for granted, don't we? Muchas gracias.
Thanks so much for that, Monica. Just so many beautiful images and so moving. Yeah. And I suppose I'm just going to speak to the fact that sometimes, particularly the image that you had from the depressed patient, it just really struck me that just a few tiny little lines can represent so much. Yeah. And how is it that with cartoons and comics that they are just that bit more relatable to us with just a few short little lines without, lots of imagery and, extra words, and yet with these lines we can really hear the stories. So tell us a bit about that.
That would fill several books about the theory of comics. They've got such a different language. They can do anything. With a comic you can do anything. You can express yourself in ways that are not possible with other mediums. In particular, that image that you said, not only you look at it and you see this woman in despair, but you can imagine the author drawing. There's so many lines. Did you notice? You can see, you can imagine the author looking really sad and just going with a pen like that and spending a long time just feeling. So it's about what you want to transmit. And sometimes like this is about how you do it. So it's really fascinating. There is so many things that you can do with comics. I think one of the things that can get them to transmit so much is the simplicity of the faces, for example. And this is something that has been deeply studied, how the more detail you give to faces, the less the reader will empathize with that character. Because what you see in other people is a lot of detail, but what you see of yourself, what you feel of yourself, is just your eyes and your mouth. That's why emojis are so successful, aren't they? Scott McCloud, who I love all his doing about comic theory, dawning comics, he tells a lot about that. In fact, he explains all the theory of comic in a comic. And one of the things he does is he represents himself in a very simple way. He says, if I draw myself the way I am, you probably wouldn't still be reading this book. And it's just true. It's just sometimes the sheer simplicity of the images that draw you in as a reader.
And we can sort of, as you say, reflect ourselves more, so that the less detail, the more we can see ourselves, or that we can see people who we recognize.
Exactly, and that's why so good for empathy. And it's just, I think for doctors, I mean, empathy and communication should be two really strong points to us. So to teach new doctors, future doctors, and to remind ourselves of what things should be, and sometimes out of pressure and out of burnout, we sometimes tend to forget, or even we don't even have the time, just scribble a prescription and that's about it. So all this going back to the basics, to empathy and to compassion. I mean, I know it's a hard way to go, but by reading a comic, you can really regain, remember, and get in touch with your younger doctor that was in you, that was full of, I'm going to make patients better, I'm going to help, and then just the time has overcome you, and you're now tired and thinking about retiring sometimes, because just things are so bad as well at the moment. So
yeah, and you had mentioned, you had alluded to the fact that we often associate comics with children, and then we think that they are not adult enough to be legitimate things for doctors to be reading.
Exactly.
And a little bit, I suppose, why we're saying with Suzanne, if we can give ourselves an altruistic reason that we should be reading them. So like in this case, we're listening to patients' stories, we're feeling the patients' stories through the images.
Yeah, but not only that, they're really good books.
Yeah.
They're fantastic stories, they're entertaining,
Yeah.
they're well drawn, they're artistic. So they're just good books for summer. It's not like you're, right, I'm going to become more empathetic, I'm just going to get this, I'm going to read this Cancer Vixen. No, it's that you get Cancer Vixen, and you have a great time, because, and most of them use humor,
Sure.
well, which you wouldn't think. I mean, this woman's got cancer, and a lot of it is really funny. So you can end up laughing and crying within pages, and it's just colorful, and it's just generally very powerful and fun. I mean, comics are fun. So that part of comics of being underground, infantile, not serious, yeah, but that's good.
Yeah.
Even for us, as very serious, very important doctors.
Yeah.
So we get the fun part of comics and move it into something exciting and useful for
Sure.
us, which would be like the important, the reason why I'm here now. But it's just reading comics is just, to me, I mean, many people who now are into comics as adults say, oh, no, I've been reading comics all my life. I haven't. I haven't. I could say rediscover comic. No, I discovered comics thanks to Ian Williams. And I found out how powerful they are when I was in the search of good material to teach and learn ethics. So that's the weird way I ended up.
Well, I love
with
the fact
comics.
that you turned the medical ethics code into a comic. I mean, I would read that. I have to say, I haven't necessarily read fully our own code recently.
Well, it's funny because most people don't.
Yeah.
And that was the reason. There were two reasons. One is let's get people to read the code because it's got many answers in it that we don't know. And the second one is let's let the society know what they should be expecting from us.
And I love the multi-layered communication. So like that, the communication isn't for doctors to doctors. It's not for patients to patients. It's a real integrative sort of story and relational device.
Exactly. And again, this Conciencia Médica, there are doctors or nurses who told me, you know, I bought your book, and this is my 8-year-old son reading it. Of course, it's a comic, so it will attract children as well.
Sure.
And I made sure that it's all understandable. I haven't used jargon. If I've used some medical words, then I put a little star and a bit of an explanation there. So I made sure that it's for doctors and medical students, mostly a bit for medical students, because most doctors know their code very well. So that you can move the student, particularly the non-clinical students, from a scenario that they're only imagining into a real medical scenario where they can just really put their thoughts into what's, for example, confidentiality. I mean, it's a complex thing to think about. You can think of it as a very simple thing, but then you move that into a full day of the amount of time that you can break patient confidentiality, turn that into a comic. And it really brings confidentiality down to something real, just because you are talking about it in the right place, which is a real made-up scenario. I mean, there are films that you can use. Many people use bits of certain films to show medical students or in communication seminars or doctors or whatever, bits of where you make the patient feel bad and all this. But in comics, you can just create exactly the sort of image that you want, the sort of scenario that you need to explain a certain concept. So
you showed the brain, the men walking across the brain. So like you can't, it's very hard to construct that in any other way.
Exactly.
Whereas there you have it in the comics. So I suppose we might have time maybe to take, if there was any questions from the audience, if there was anybody who wanted to ask Monica anything about comics. While we're waiting for any questions, I might ask you, do you find, is there an intergeneration, or is there a generational difference in how people accept the comics? Do you find that maybe the younger students have a different approach or not? Is that a
funny?
myth?
I was expecting that. I was expecting for the younger, the medics, the more keen, but it's just the other way around. I think as you mature, you are okay. You don't feel threatened by getting a comic and say, let's have a look at this. When you're very young and you're a medical student, like, hello, I'm a medical student.
You're too perfect for that.
Medical student.
I can see how that
so,
would be.
So I was expecting that. But
oh, sorry, we do have a question there at the back.
Hello, thank you very much for that interesting talk. My name is Shireen, and actually I'm involved with medical education. And I have used before in my lectures, so I lecture on things like communication, breaking bad news and things like that. I've used art, poetry, and the narrative to teach that sort of empathy aspect of it. And so graphic novels seem to be a beautiful collection of all those things. So just to break it down a little bit, obviously you've touched on using them for teaching purposes for medical students. First of all, is there a directory I can find somewhere of these graphic novels that I can use in my teaching or advise, the students to go and find? And second of all, do you use them for patient education at all?
Okay.
Thank you.
Thank you for both questions. There is now several communities of people working on creating these directories and trying to bring graphic medicine, which is the term we use, to bring it forward and to say, hey, people, look, we found this tool and it's really amazing. So the graphic medicine community has got, or we have, and now I'm part of the international group as well, this great webpage where you can find lots of graphic novels, and they're all reviewed. Some of them are not reviewed yet, but lots of them. And it's graphicmedicine.org. If your Spanish is okay, the Spanish group, we have as well a great webpage where we review a weekly graphic novel. And in fact, the way we do it in the Spanish group is we try to focus on the usefulness of that particular graphic novel. So we say, this particular graphic novel is good for you to reflect on death, or talk about confidentiality, or talk about how patients face illness, or whatever it is. So we are maybe a bit more patronizing, probably, but we try to direct a bit for people who want really to use these comics. And our webpage is medicinagrafica.com.
About patient
yeah. Of course, but you have to be careful. I mean, the ideal thing is that we will end up prescribing comics, but you need to know very well what comic you prescribe. Some of them are too depressing for a patient. Some of them have got the same illness, but a completely different position. I mean, illness is about one single person suffering with that illness. So if you know very well 2 or 3 graphic novels, you might start using them with patients. Some people are already doing them. I know a few Spanish doctors who are already advising their patients novels that they've read. But the fantastic thing about comics is that a great way, a great language to transfer knowledge in a very simple way about illnesses. I tend to do that as part of my work, transferring or translating, as I like to call it, translating complex medical information into something that could add up to medical education of the general society. And it has been so useful during the pandemic. During the pandemic, I have drawn non-stop from dawn to dark. Is that the right thing to say? Dawn to dark? Yeah?
Dawn to...
No. From, well, the whole day long.
Okay. Dawn, dawn to dusk.
Drawing all day long, doing this, like what are the symptoms of COVID? Or what do you do if you think you've got COVID? I mean, I've spent the first 3 months of the pandemic, particularly of the pandemic, just drawing information for patients just to try and help out to the anxiety with what we knew, which has never been much, but trying to turn that into a language that is easily digested, friendly, and avoiding the jargon. And the comic is just perfect for that. It's perfect for education.
Yeah, and I think we are seeing that a lot really recently in terms of public information around the pandemic, and that and kind of the use of those sort of infographic type things with the little music, the little ditty next to it. I think we're all kind of familiar with that.
And then the social media as well, that makes it so useful that you can transmit clear, scientific, fun messages in a way that will just come up as one single image. I mean, we've stopped going into links. I'm sure you have as well. Something that, a good tweet with a link, you go, oh yeah, I'll put a like and I'll read it later on. I'll put it later on. So we've gone increasingly bad at going into links. So you open a link, you see all this text, which goes beyond one screen. Now, it's all about attention. We've been hearing about attention this morning. It's true, we're horrible with attention, but then we have to be aware that attention is going down for everybody. So we need to know, to use the knowledge that is happening into finding new ways of transmitting good information.
Absolutely, the right information is in the right quantity.
Information is a way of doing good medicine. So that's what I do, I hope.
Yeah, well, thank you so much, Monica. It's been certainly enlightening for me, and I hope for everybody else. So we're actually going to just take a little quick break now, a very quick break. I've been told.